Good afternoon and welcome to the Department of Behavioral Health Weekly Update. We'll jump right in. October is LGBTQ plus History Month. I'm going to remind myself, what else is it? We know it's National Latino and Hispanic Heritage Month for one more day. So all kinds of activities are listed on our website and you should be getting emails about them. All right, COVID by the numbers. We're now just under 240 million cases of COVID, just under 4.9 million deaths due to COVID. There has been over 6.5 billion doses of vaccine administered. That is a really remarkable amount of vaccine. In the United States, we're just over 44 million cases of COVID and just under 709,000 deaths. In California, of note, our productivity has dropped from 2.6 to 2.2%. Remember, the goal really is to get it under 1%. That's when you're really managing well and you shouldn't have huge outbreaks. And so 2.2% is better than we were last week. We kind of hovered at 2.6 for a couple of weeks. In Fresno County, we're now at 132,055 cases of COVID, with 2,048 confirmed deaths. So we've increased by about 40 deaths. September was one of our highest death months. We should expect October to continue to be a high month for deaths, given that our deaths trail the actual cases. In terms of youth, we're now up to 27.4 thousand confirmed youth cases in the last month. And that is an increase of about 700 over the prior week. Hospitalization, we're finally seeing a little more drop. We hovered and hovered and hovered in the 260s for several days. We're now at 247, 54 individuals in the ICU and 16 available ICU beds. For youth, our numbers are still up a little bit. They kind of came down and then they went a little back up again. And so that's something that we'll watch closely. For testing, we're now at 7.5% test positivity. This is a little bit of a concern for us. Remember, we need to get down to 1. The state's at 2.2. We're 3.5 times as much as the state. So we still haven't gotten control of our positivity rate. As long as that positivity rate stays high, we should expect to continue to see people be hospitalized for COVID, and we'll continue to see some people die of COVID who are hospitalized. And so it's only a 0.3% decrease from 7 days prior. We've got to get that number down. And one of the ways to do it is vaccination. We're now at 1.139 million doses of vaccine. We have 481,206 individuals fully vaccinated, another almost 95,000 partially vaccinated as we continue on that march towards enough vaccination that we quit being a leader in the state for hospitalization. We remain the leader in the state for hospitalization per capita. And it's really very closely tied to our lower vaccination rate. I've shared that statistic before. I've shown you the graph that Fresno County, for large counties, has the highest hospitalization and the second lowest vaccination rate. All right, for youth, we now have 37,660 of our youth, remember this is 12 to 17 years old, are now fully vaccinated. 44,020 have had at least one dose. So you can see that since February of 2021, we had the most recent surge. We are coming down, but we remain above the state of California, the average. And we're now starting to see more counties, including Fresno, in the red tier for test positivity, but we all remain in the purple tier for cases. And remember, both of those need to come down. So overall, cases continue to decline. Hospitalizations are slowly dropping, but deaths are increasing. Positivity rate continues to decline, but very, very slowly and remains high. And then just a general reminder about the flu vaccine and that is a mandate for people who work in healthcare organizations such as ours. Across California, better declines than in Fresno County, continued positivity rate decrease, and the same increase in deaths. Nationally, we're now at about 89,000 cases a day across the United States versus 160,000 a day at the beginning of September, so almost half. But there's still trouble spots. Now they're in Colorado, Vermont, Michigan. Alaska remains a difficult location. FDA is continuing to discuss Pfizer shots for children. Just before this meeting, they recommended boosters for individuals who'd had Moderna. I know there's going to be a lot of questions about this. We will be working on a strategy for offering booster shots for individuals who were vaccinated initially with Moderna, and we will get that information out in the next week or two. We're just entering the time where the very first people who got vaccinated would be eligible for that booster shot. And so keep in mind that back when we started vaccinating, we had one of the only clinics offering vaccine shots. Now you can get those anywhere. So if you are eligible for a Moderna booster shot and you are wanting to get one, you don't have to come to our clinic to get it. You may go to any of the drugstores in town, your private physician, as well as any of the vaccine clinics available through the county. So please feel free to go on the county's website, find one of those clinics, and get your booster shot without waiting for us to come up with a solution. In the meantime, we will work on offering some options. Johnson & Johnson is still being reviewed. I read yesterday that there's some concern about the evidence that they provided, so I anticipate that that will be a little slower in coming in terms of a recommendation for a booster shot or not. I did hear a little bit yesterday, and this is just complete I am not a scientist, but this is what I heard on the news yesterday when I was listening to the radio, is that they're also right now investigating, particularly for Johnson & Johnson, if you could get a Pfizer or Moderna shot as a booster. Some preliminary studies are showing that that might provide even better enhancements than a second Johnson & Johnson shot. So this might be something to consider in the future if that's recommended by the FDA as well. All right, the immunity question. I get it every week. I promised last week that we will talk about immunity and the benefits of natural immunity. So many questions. Answers are slowly emerging. And, you know, I really do want to emphasize, I appreciate, particularly for people who have had COVID and have some natural immunity, there may be some resistance to getting the vaccine. And largely what I've heard is people saying, well, why do I have to get the vaccine if I have this natural immunity from COVID, and it doesn't make sense to me. And so, you know, I will share what I know, what I've been able to find. But what I will also tell you is that it's really just from a lack of information, because we've only been in this for a year and a half. We've only had vaccines for less than a year. So most of the studies that have been done have had limitations, or some of the early findings which came out have not been as solid under further, more rigorous scientific review. But the most important thing is time is going to have to pass for us to know with assurance what the immunity is for each of these situations, natural immunity or vaccinated immunity, and also how long it lasts, how strong it is, and how long it lasts. And furthermore, some of the ways that we measure immunity are not the only ways that our body can fight off a virus. So the neutralizing antibodies in your blood, those are things that bind with the virus and prevent it from replicating in your body. Remember, viruses are just replicating machines. Mostly what they care about is finding a host that they can reproduce in. They're mindless. They don't really have an end game here. They're just all about reproducing. That's what they're here for. And they're finding a host. They can't do it on their own, so they have to find a host to replicate in. The more they replicate, the more chance that there could be changes in their DNA of the virus, and that could result in variants. And that's what we've seen with the massive outbreaks. The more people, and boy, we got lots of people, right? We've given over 6.5 billion vaccine shots and have large swaths of the world that have gotten no vaccines at all. So when you have so many people who get exposed to COVID and get COVID, that chance of variance increases. So we don't know that people who got COVID a year and a half ago will have any resistance to the new variants. The same can be said for some of the vaccines. As time goes on, we'll have to continually. So we're going to constantly be having to research. And what we know today will change based on new information. Not because we're lying today, not because they're trying to mislead the public, but because we don't know yet. Time has to pass in order for the studies really to demonstrate the types of information that we're looking for. So the answers to this question are complicated because of the studies that have been done with all those limitations that I just said, there's contradictory conclusions. So it's not like all the studies show the same thing. In fact, each of them shows slightly different things, and each of them has what we call limitations, and I'll go through what those limitations are. There are some consistent patterns emerging in some of the studies. So where there's agreement, I'm going to talk about that, and then some studies, the one that people cling to the most is the study out of Israel, and so I'm going to talk about that as well. So what we know so far. 2 doses of an mRNA vaccine produce more antibodies. Remember the antibodies. You also have T cells and B cells that are in your body after you've had an infection or after you've had a vaccination that you don't necessarily measure when you measure antibodies that could have a strong role in immunity, both for vaccinations as well as natural immunity. And so their role could be more evident in terms of whether or not we see reinfections, hospitalizations, and death. And most of that information we'll find out over time. We don't know yet. But when you measure antibodies after vaccination and compare that to people who've had natural infection, they produce more antibodies. However, antibodies from a prior infection are more diverse. And what I mean by that is there's just more work that your body does when it produces the antibodies that are capable of fending off a wider range of variants than those produced by a vaccine. But the strength and durability of that response is variable. So studies have shown that certain people who've had COVID might have a better immune response than other people who've had COVID. And I'm going to say this over and over. Most scientists, most medical professionals still believe that the risks of infection, and remember, the way you get natural immunity is you get COVID, far outweigh the risks of vaccination, and that the benefits of vaccination are good enough that the risks of getting that more diverse response from natural infection isn't really worth it. So there's that. One thing about immunity from a prior infection, so when you've actually had COVID, is that typically it stimulates defenses in the nose and throat. And a vaccine does not. And so that it is believed that may be one way that is a better response because it teaches your nose and your throat, which is typically where you breathe in the virus and get it. It gives you some additional defenses that the vaccine might not give you. One of the things that's being worked on right now for is like a nose spray, something that we would all put up our nose as a preventative, something that could, much like a vaccine, but not exactly like a vaccine, serve to help us resist that virus from taking a hold in our nose or throat. The other thing with natural immunity is they think that because fragments of the virus might persist in the body long time, it could enable your body to continue working on that immune response longer. Remember that notwithstanding some people's belief that there's a microchip in the vaccine, the mRNA vaccines and the Johnson & Johnson vaccine, the nature of the mechanism for how the vaccine gets into your body is it disperses pretty quickly. So the vaccine itself disperses pretty quickly, so it doesn't stay in your body a long time. So the immune response you get is from that vaccine, but it doesn't stay in your body a long time. The mRNA instructions are out of your body fairly quickly. What they have seen is for early versions of the virus, so people who got the virus pretty early, reinfection could be rare, but no data yet for Delta. So when people get Delta, we don't know how they will do. And then most studies are less than a year out. So very early kind of preliminary results. So I really want to emphasize natural immunity isn't a bad thing. It's not like we don't want to credit people for having natural immunity. We just can't rely necessarily on the natural immunity because we don't know for individual people how strong their immune response was. Okay, so the most widely cited study on Delta is the one out of Israel. It found that breakthrough infections are more likely after vaccination than those who've had a prior infection. So in Israel, they were able to measure people. They have a pretty high vaccination rate there. And as they were getting people vaccinated, they were able to measure, okay, people who were vaccinated, how often did they get infected versus people who had the Delta variant. But the study is limited here. So it did find that. But in Israel, the first people they vaccinated were people who were older and people who had underlying health conditions. For almost all of the breakthrough infections, whether it's in vaccinated or folks who've had COVID before, if you are older or have underlying health conditions, you are more likely to have a second infection, a reinfection, a breakthrough infection. And so it's unclear in that very preliminary study out of Israel how much that influenced the results. So you didn't have apples to apples comparison. So what I mean is, when they study a vaccine in a trial, they have a group of people that look a whole lot like the group of people who get the vaccine, don't get the vaccine. In this particular study, the vaccinated group did not look like the group who had previously had COVID. And so when you compared the two, these people had underlying health conditions who'd been vaccinated and it may have been more likely to have a reinfection anyways. So that's what we call a limitation of the study. It's not where you throw the baby out with the bathwater. It's not where you say, well, we're not going to believe any of the study. It's just you have to take it with caution. You have to understand that because they weren't conducting a research project, they were retrospectively reviewing information. They were not able to get, a homogeneous group of people. So it's just a limitation. And it also didn't account for people who may have had 2 bouts of the virus. So let's say people that they measured as having prior COVID could have had COVID more than once. And if they did, that would almost be like having COVID and having a vaccination. They might have stronger immunity than someone who had only had COVID once. Again, not to throw out the results of the study, but simply to say that's a limitation of a study. Oftentimes when these studies get produced, they have limitations. So they might say, in 9 months, we've seen no long-standing effects. Well, only 9 months has passed. That's a limitation of the study. We don't know what will happen at a year or 5 years. Same with this. There's just some limitations of the study. What the studies also have shown is that the people with the highest measurable antibodies are people who've been vaccinated after having an infection. So what that means is if you've had an infection, you will get a boost to your immunity by having a vaccination. And that seems to support that even if we're requiring people to be vaccinated who have COVID, we are giving them a boost to their immunity in doing so. It's not worthless. It's not just a waste of time or a requirement that gives no value. It actually does boost your immunity. So that's another argument that's being utilized to justify the vaccine mandate, along with just, again, not having a lot of supporting information about the sustainability as well as the strength of the immunity that you get with a natural infection. So those people show the highest resistance, the most antibodies. And then the other thing again is that you have to get COVID to get natural immunity, which means you have a risk of being hospitalized or dying, and you also have a risk of long-term impacts. And this is another area that we're just learning about. More and more information is coming in that some people, even who had mild infections, people who did not get hospitalized, are experiencing long-term impacts from COVID that seem to be attributable to COVID. there's going to need to be a lot more research done to know, is there a subset of people for whom they are at higher risk for that? Are there circumstances or symptoms that those people had that could be predictive to tell us whether or not they will have long-term? What is the benefit of vaccination versus naturally getting COVID to getting those long-term effects? So what I mean by that is if someone is vaccinated and gets COVID after that, do they avoid those long-term effects? Early on, when people were first getting vaccinated, some people who were having long-term effects had those resolved with vaccination. Not everyone, though. And so that's something as well that's being studied. And so that's what we know so far. I didn't go into detail about each study, but tried to summarize what's in each of them. And hopefully that provides you with some information that gives a fair representation of the benefits of natural immunity and the benefits of vaccination comparatively. So I will go to questions. Remember that you can text me. Okay. One question via text regarding flu shots. What do we use as evidence and who do we submit the evidence to? Most places you go, for instance, when I went to Target and got my flu shot, they'll give you a piece of paper that says you have it. Just provide that to Human Resources. Is there any news for booster shot? I have 2 relatives who are currently quarantining and who were fully vaccinated a few weeks earlier this year, and they just got COVID. So right now, the booster is approved for Pfizer, and it is approved for people over the age of 65, people who have underlying health conditions, and if you work in high-risk profession, which includes healthcare providers. If your relatives fall into that category in any way, shape, or form, they can get a booster shot anywhere that the vaccine is offered. When the Moderna goes through the official approval for booster shots, I believe the same population will be eligible for them. People who are over 65, people who have underlying health conditions, or people who work in high-risk professions. And as far as when you can get the booster, if you've had COVID, it's really just something to discuss with your physician. Remember, in a couple of weeks, we're going to have Dr. Vora on for our all-staff meeting, and that could be a question we can ask him to solidify between now and then. But generally speaking, right now, it's my understanding that once someone is physically well enough to have the booster, they could get the booster. When the FDA approves vaccines for children, will our department offer on-site vaccine services to kids as well as the parents at Heritage like we already are doing at Metro? Certainly something that we can consider. Right now, you can go, again, to any of those places where vaccines are offered to get your vaccine for kids 12 to 17, and that's available right now. I believe that's just the Pfizer is available. What is being reviewed right now with the FDA is 5 to 11. So once 5 to 11 is offered, we'll work very closely with the Department of Public Health to ensure that there's adequate locations for vaccinations to occur. And if they ask us to participate in that through our clinic, we'll certainly attempt to do so as we've done previously. By what day will we be required to get the flu vaccine? I believe it's towards the end of October or November, but we'll get that information out. If Helen or someone else is online and can provide that information in the chat, feel free to do so. Is the natural versus vaccinated immunity similar to varicella or no? And varicella is chickenpox. So this is one of the challenges with viruses, and it's been a few presentations ago that I did a little bit of information about this, so I don't want to misrepresent specifics, but I'll tell you in general. Viruses are different, and some viruses you get it and you'll never get it again. And other viruses like chickenpox, I just got the shingles vaccine. The shingles vaccine is related to chickenpox, shingles are, and so that's one of those things that over time we went, oopsie, even if you had chickenpox or got the vaccine, you could get shingles. And so some vaccines are one and done, you don't have to ever get them again. Some vaccines require you to get a booster shot. Right now, that's the big question with COVID, and there is Certainly when you're in the midst of a pandemic, the bar is at a different height, right? So we are trying so desperately to get out of this pandemic. And so at the first sign of waning immunity, even if immunity remains pretty high, like it's been 90 to 95% for the mRNA vaccines, but what's the level? What's the cutoff that we'd be willing to accept to avoid having a booster? Is it 85? Is it 75? Is it 50? Unfortunately, it's organizations like the CDC and the FDA who make those recommendations. But as soon as they see decreasing immunity, that's when they start considering booster shots. When you start to see people who've been vaccinated previously begin to get infections again, then that's when you start thinking about, okay, is there a specific population who's more likely to have a reinfection earlier and then they might get a booster sooner? Or for instance, people with compromised immune systems, they made the determination that right off the bat they should get 3 shots instead of 2 shots, so boost their immunity a little more. And so those are all things being investigated right now. But right now it seems like COVID is a type of virus that it will be recommended to get a booster shot at least once and possibly more in the future. Remember, the flu is a vaccine that you have to get a booster shot every year. And the reason you get a booster shot is because of variants of the flu. It's not because your immunity necessarily wanes, it's that the flu changes and we have to have a different booster to address the variant that is most likely to be present in the coming year. Okay, I don't see any other questions right off the bat. But if you have any questions, if you're viewing this in a recorded fashion, or you have any questions that you think of after viewing it, please feel free to email myself or Tina Young. We'll be happy to bring up those questions at the next update. And as usual, have a nice rest of the week and a safe weekend. Last weekend of the fair. All right, be safe. Just delay and get it extended.